Hi, I'm Nerida McDonald from Walker Street Doctors, and this is an update for Monday the 28th of February 2022. 2 weeks ago we spoke about masks, the fit, the filtration and the fashion. As a healthcare setting servicing vulnerable patients, Walker Street Doctors will continue to mandate the use of masks, and we'll likely continue this indefinitely, as we have been doing continuously since 2020. This week I'd like to focus on indoor air quality and what we at Walker Street Doctors are doing to optimise the indoor air quality in our surgery. We all know now that indoor environments increase the risk of transmission of SARS-CoV-2 by containment and concentration of the airborne virus. And we all know that dilution is the solution to pollution. By bringing outdoor air into the indoor space, by opening the windows, the fine particles that carry virus can be diluted. We've also had Vornado circulation fans in each room and a ceiling fan in the waiting room, in addition to small desk fans to assist with this dilution process for some time now. But one of the problems with this strategy is the increase in ambient noise layered over mask wearing, causing communication difficulties. And then of course there's the heavy rain that we've had in the last week, and more to come. We recognise that there are times when conditions are such that we can't reasonably open our windows all day long, and may have to be satisfied with flushing the rooms with open windows when the rooms aren't occupied. That is before 8 a.m, from 12 to 1, between patients and while we're doing telehealth. As a backup plan, we've invested in air purifiers. Walker Street Doctors now has a HEPA filter air purifier in each consultation room and in the treatment room, and 2 large capacity high quality HEPA filtration air purifiers, one in the reception area behind the perspex and one in the general waiting room. Best practice is to have an air purifier which has a clean air delivery rate, or CADR, which is 2 to 4 times the volume of the room per hour. So, fun facts. Our largest consulting room has a volume of 34 cubic metres. The air purifier we've chosen for each of our consulting rooms has a CADR of 190 cubic metres, equating to filtering 5.5 times the volume of the room each hour. Our reception and waiting areas combined have a total volume of 93 cubic metres. Our 2 large filters have a combined CADR of 800 cubic metres, and this exceeds best practice by filtering 8.5 times the volume of the room each hour, which is kind of reassuring. We know that the role of air purifiers is not actually to filter out CO2, but that CO2 is a surrogate marker of indoor air quality. And we now also have CO2 monitor in every consulting room, in the treatment room, and one at reception, which are all set to pandemic settings. That is, amber alert at 800 parts per million and red alert at 1000 parts per million. An alarm will alert the occupants of the room to open up the windows, turn the fans up to turbo, and actively flush the room. As at Monday, the 28th of February, neither our nurse nor any of our 9 GPs have had COVID, and I would really like to keep it that way. We're hopeful that the combination of measures, indoor air filtration, ventilation, mask wearing, staying at home when unwell, and decreasing occupant density with telehealth delivery will optimise occupational health and patient safety into the distant future. I hope that update has been helpful, if not a little nerdy, and the update next week will centre around COVID boosters largely.